It's quite exciting really to have a single app across Birmingham and Solihull that patients can use, because they can use this app for a number of reasons. They can book appointments, they can order repeat medications, they can even use a symptom checker to see what kind of appropriate services might be available, whether they can see the pharmacist or they need to see the GP or perhaps the practice nurse. And that means that for patients that they have better access to services, that it's quicker for them, they don't have to be hanging on the phone if they're trying to order a repeat medication, and that if they're concerned about a particular symptom, they get help with being directed to the most appropriate place. It frees up time, particularly for the reception staff, who then have more time to help patients along their journey, wherever that is. The app also allows you to book extended hours and understand whether those are available, and that's exciting because it's about choice and convenience for patients in how they want to access appointments. We understand that it can be difficult to get to see your GP at the moment, and an app like this should improve things. And that app also allows patients to understand a bit more about their records, and I think helps to facilitate what we call self-care. So patients beginning to look at health information through the application to think about how they can help us help them with their various health conditions, whether they're quite acute conditions or long-term conditions such as respiratory disease like asthma or heart disease or high blood pressure. I think quite a lot of patients are Googling symptoms, and sometimes they're directed to the right kind of information, and sometimes they're made more anxious. But it's not very structured, whereas with the Birmingham Solihull app, the symptom checker that we use, it's much more structured, and it's designed to fit into what services we have locally. And that's quite important because services do vary around the country. I think the app will help patients navigate what can be quite a complex system. Birmingham Solihull app is not meant to be a replacement for actually seeing a healthcare professional, but what it does is it makes that access more efficient, and any action and follow-up that's perhaps needed.